Hey friends, Dr. Nixon here. Excited to walk you guys through some heart health tips, tools, supplements for cardiovascular health. Man, if you've heard my story before, I'll give you the quick version if you haven't. Part of the reason I got into the holistic health space, chiropractic, functional medicine is a story about my dad. My dad was in his mid-40s when he had his first heart attack. He had another one shortly thereafter. He was on many medications. And they did a quadruple heart bypass after a second one. And long story short, my father was able to reverse heart disease, high blood pressure, high cholesterol, type 2 diabetes, metabolic disorder, lost over 100 pounds. He had to do a ton of lifestyle changes. He was getting adjusted. He was working with his chiropractor, had to exercise, had to quit smoking. He did a lot. And now my dad's in his 70s, mid 70s. He's on no medications, and I have my dad back. Awesome. Cool story. But I care a lot about cardiovascular health. I think is also part of my point. When my parents moved up here, I want to say about 6 years ago now, and his health started to decline again. And he was back on blood pressure medications. He was having tachycardia, regular heartbeat. Kidneys were acting a little funny. We all do, I guess, sometimes. He had slipped back into some old patterns. And so in them moving up here, it changed a lot of their stress, but also changed a lot of his lifestyle as his son, but also as his doctor. I was like, hey, let's get it together. Let's run some labs. Let's figure out what's going on. I actually worked with a cardiologist. His name's Dr. Jack Wolfson. If you don't know that name and you have any type of heart disease or high blood pressure or cardiovascular stroke stuff in your family, or you've ever been told like, hey, this is a genetic thing for you, look this guy up. Dr. Jack Wolfson, board certified cardiologist out in Arizona. His wife's a chiropractor. He leans all the way towards holistic health. And so I worked under him and with him for, I want to say a couple of years on my dad's health and making massive health changes, cardiovascular stuff, running different labs, new labs, stuff that other doctors were not talking about at all. And we were able to get my dad back off high blood pressure meds, the tachycardia, the regular heartbeat gone, the fibrillation stuff gone, off Eliquis, so blood thinner they tried to put him on or had him on. And so I can't say thank you enough to Dr. Wolfson. I'm so grateful for all the education that I've learned. And so now I just get to apply that to my health and my life. I run certain lab tests on myself as a preventative. I will say this, if you have heart disease, cardiovascular health, high blood pressure, potentially even a genetic connection, if your dad or mom or someone in your family has also struggled with that, and you want to prevent things like that, or if you're in that boat right now and you need some help in reversing it, let me know. Just find that link below and click my discovery call. Let's hop on a call. I'd love to help you. But today's training, let's get down to it. I want to walk you guys through some things that'll be helpful. So really just practical, nitty-gritty heart health supplements that will serve you well. Fish oil. Everyone knows what fish oil is, but one of the things it does is it increases good cholesterol and lowers bad cholesterol. I like this one. It is a high potency EPA and DHEA omega-3. Most people get enough omega-6s and omega-9s. We typically don't get enough omega-3s unless you're eating a decent amount of fatty fish, which comes along with potential things of its own. And so fish oil is really helpful to lower triglycerides, really helpful for the cardiovascular system. We use this one all the time to help patients reverse things like high cholesterol. A really simple thing you can do is take this before bed. It helps your hormones, men and women. Men, it'll help you make testosterone at night. Women, anti-inflammatory for your hormones. Here's another one. This one we actually used on my father. It's called Arterosil. It is from a company called Calroy. They have done incredible research on healing the internal artery. This is wild. So the internal part is where you'll start to see plaque build up. You'll start to see inflammation happen in this part of the vascular lining. What this product does is it works on something called glycocalyx, and it can literally help improve and heal and regenerate this. It also works on the elasticity of your arteries. So when arteries become hard or calcified, that's bad. We want elasticity and flow in between the arteries, and this helps it, and that improves things like blood flow. This product was awesome. My dad, like I said, had a quadruple heart bypass. We've been using it, and it's also improved circulation in his legs, helping to improve and reduce his neuropathy symptoms. Vasconox, here's another one. You've probably heard of nitric oxide. It's a vasodilator, so it opens up blood vessel, which is great. It can help improve things like high blood pressure, vascular function, getting oxygen to nerves to heal things like neuropathy. Male reproductive organs will benefit from nitric oxide. And it also helps improve and lower blood pressure. This Vasconox, also from Calroy, private label through Designs for Health. This stuff's awesome to improve nitric oxide. Athletes will also use this stuff before exercise, as well as improving recovery. Curcumin, this is the next one. This can help in many, many, many things. Inflammation reduction. Think about it that way, which can happen anywhere. Your heart, cardiovascular system, your brain, your joints. It's helpful as an anti-inflammatory for pain. I love curcumin, specifically this one, C3, letter C, 3. This blend of curcumin is the one that I have seen to have the highest amount of curcuminoids. What that means is it's the strongest. And it's the one that I personally use. It is my favorite to use with patients. Very, very helpful getting that into your body. I will say, going back to CRP real quick, curcumin real quick. If you have any heart disease in your family, if you have high blood pressure, if you've had a stroke, if you're at risk for any of those things, or if you're just a living human, you should ask your doctor for this test. It is called HSRP. It stands for high sensitivity C-reactive protein. It is a cardiovascular inflammation number. Am I inflamed? Good question. If a patient feels inflamed, we would say, hey, let's run some labs and figure out, are you inflamed? And if so, what kind of inflammation and where might it be coming from? HSCRP, you want your number very, very low. Very, very low. Under 1 is optimal. And nearly any doctor can run this test. Your primary doctor knows what it is. You don't have to be under the care of a cardiologist to get it done, but you gotta a lot of times ask for it. If it's high, what we typically do is these supplements. We will change nutrition. We'll talk about diet, exercise. We'll talk about the vagus nerve. That's the part of the nervous system that helps manage stress and fight or flight, rest and digest. And we'll use these supplements to do that. So here's another one. I think it's the last one, magnesium. I love magnesium. Most people are on the lower end, potentially deficient in magnesium. Some research would show. And it's an easy thing to get into your body. A lot of the reason why is just our soil is not what it used to be. A lot of vegetables grown in dirt is going to have magnesium in it. The soil's depleted. Vegetables aren't grown in dirt anymore. There's a whole host of reasons. But getting magnesium into your body will help your brain. It'll help you sleep. It'll help your nervous system heal and regulate. It'll also help with heart rhythm and relaxing your blood vessels, which would then, again, improve overall heart flow. We see this stuff reduce things like high blood pressure. If someone has tachycardia or arrhythmias, we can see magnesium play a really vital role in changing that and improving that. It's a really simple supplement to find. I like magnesium glycinate. There's a bunch of different ones. We'll use them for different things. Magnesium glycinate, really good at calming your nervous system, helping with blood flow. Magnesium oxide, another good one. Magnesium L-threonate, really good. It actually crosses the blood-brain barrier. If you're dealing with something like maybe stress-induced high blood pressure, I would recommend looking at magnesium L-threonate. It can be really, really helpful in relaxing that. And obviously, nutrition plays a massive role. And if you're watching this video and you're asking the question, hey, where do I start? It's cutting out sugar, cutting out processed foods, cutting out grain, things that turn like pasta, things that turn into sugar. So no sugar, no processed foods, cutting out grains, and then increasing things that would have those ingredients in them. So the ones I was talking about, the supplements. So for example, the Vasconox, nitric oxide. How do I naturally increase nitric oxide in my body? Beets would be the answer. How do I increase curcumin in my body? Eat turmeric, juice it, cook it in something. How do I naturally help my blood pressure go down? Things like garlic, sulfur-rich foods, dark leafy green vegetables, adding these things into your body. How do I increase my magnesium naturally? Go to your farmer's market and get vegetables from a farmer who is tending to their soil. Things like that. So there are a lot of nutrition ways to also support this, not just vitamins. I don't love putting people on bajillion vitamins and saying, see ya. I like starting with food first, lifestyle changes, supplement a healthy lifestyle and diet. And so I hope this was helpful. If you have any questions at all, any way I can support you, find that link below. Hop on a call with me. I do these for free with people all over the country. I'm not your doctor, so I'm not going to prescribe you all these things, but I will ask you some questions and get you pointed in the right direction. And if your next step is to work with me, I'd love to serve you in that way. So, all right, friends, this is Dr. Nixon. Be blessed.